Osteoarthritis, often called the wear and tear disease, silently affects joints and reduces quality of life. This common joint disorder damages cartilage, the cushioning tissue at the ends of bones, leading to pain, stiffness, and reduced mobility. Simple activities like walking, bending, or climbing stairs can turn into painful daily challenges. Morning stiffness and reduced range of motion make joints feel rigid, affecting productivity and mood. As osteoarthritis progresses, joint instability increases the risk of falls, while constant pain may lead to stress, anxiety, and social withdrawal. Advances in regenerative medicine are opening new possibilities, focusing on repairing damaged cartilage rather than only managing symptoms. Stem cells, known for their regenerative potential, are introduced into the affected joint to support natural healing, reduce inflammation, and improve joint function. This minimally invasive approach promotes natural healing, reduces inflammation, and may provide longer-term improvement in mobility and pain. Treatment plans can be personalized, using cells from the patient or donor sources, depending on individual needs and osteoarthritis severity. Consult a qualified medical professional to understand whether regenerative stem cell therapy may be suitable for your osteoarthritis. Can stem cell therapy treat arthritis? Stem cell therapy is being explored as a supportive option for knee, hip, and shoulder arthritis, focusing on cartilage support and tissue repair. Can stem cell therapy improve knee osteoarthritis function? Studies examine how stem cells may support damaged cartilage, help manage inflammation, and gradually improve joint flexibility and comfort during movement. Some patients report better walking comfort and activity levels over time, especially when combined with physiotherapy and regular follow-ups. Can an osteoarthritis patient avoid joint replacement surgery? This therapy focuses on supporting joint structure naturally. In some cases, early intervention may help delay the need for joint replacement, depending on the cartilage condition.